my first piece of advice is just start with a conversation. Start with a comfortable conversation. So in other words, you might not be able to pull all of or rally all the stakeholders that you want to see around the table the first go round. You might not be able to get the buy-in of the entire organization to get it started, but to get a conversation started, I believe that's what really starts the movement, and that's what starts the change in the culture. And so I would recommend, however big or small, get the conversation started. And then with the conversation being started, obviously you identify your champions who then propel this initiative in a whole nother realm or a whole nother space. So what ultimately happens is you kind of create this bond among people and that's what MedStar has done, create a bond among people to really feel a part of the system, to really feel a part of the conversation. And you can do that both formally and informally. I've seen where organizations have more informally started programs like this, and it has morphed into something more formal, which is absolutely what we want to do. But it's important to start somewhere.
A lot of hospitals implement PFACs, and a lot of hospitals have patients involved in their councils and all that, but they don't bring the transparency portion into it. They kind of leave it aside. And to me, that's not a true culture of safety within that hospital. And I think what Dave is doing is trying to implement not only having a patient and family involved in these councils to make the changes and create a new culture of safety, a true culture of safety, but the hospitals itself is being transparent with the families, and that is creating an openness and a dialogue that never existed before. I mean, I look at it 5 years ago, and I told this to Dave last time I was here, 5 years ago, 6 years ago, when I lost my son 8 years ago, they wouldn't sit at the table with me. Today they are. And maybe 3-5 years from now, one of us will be on their board. And how great is that? That's true transparency.
Patient Family Advisory Council is really the beginning of the patient journey. It lays the foundation so that patients can have a voice all the way through the process in hospitalization, and it provides the sort of correcting mechanism that medical care needs, because without the patient voice, and it often is without the patient voice, it can get so far off track in terms of what's really going on with that patient. So you start with the Patient and Family Advisory Council defining the ways that the patient can, or that the system can best interact with the patient, can interact better than the ways it does now. And then you use that all the way through to have the patient touching base with the medical team and the medical record throughout their stay and afterwards, and whether anything happens, so that you have the free flow of information, a transparent system, and a learning system. And it all begins, I think, with the PFAC.
I think hospitals that are afraid of what people might say miss an opportunity to be surprised by what they might say. The surprises won't always be pleasant, but they'll be real. And don't you want to hear real things from from the people who use you? I mean, even if it's criticism, it will help you get better. What is important, I think, and what I think we have to work with hospitals that are building PFACs to help them realize that the quote-unquote bad PFAC member is not the person with the bad experience or the bad story. It's the person who can't see beyond their own experience to see how other patients in your hospital might be affected. So what we look for and advise hospitals to look for are people who, regardless if they've had a bad experience at your hospital, regardless of whether they've sued you, regardless of whether they've complained in some way, can they generalize from their experience to help you help future patients? If so, I say grab that person. They're going to be treasure. You can have people who are very complimentary, but if they keep bringing the story back to what happened to them, you're not going to, they're going to drag the energy of the group down. You need people who bring their experience to you, good or bad, and then work to help you create the future by drawing on that experience, but not, frankly, spending too much time talking about it. We want them to be talking about the hospital's mission, the hospital's goals, the hospital's issues, the hospital's challenges, and bring all that experience to that.